How did you get started in the biologics clinic?
So I'd just done my prescribing course then. I was starting up the clinic doing the biologic clinic, and then I was asked to go over to Aintree. Claire, do you think that you would be able to start following up these systemic patients and systemic monitoring patients in Aintree? So I'm like, oh gosh, that's, they're only just qualified as a prescriber, but yes, I can give it a go. Yes. So I started following up a lot of those patients.
Mm-hmm. And can you tell us a bit more about your role in the clinic?
My role has developed while I've been there, and become, more specialised, doing the clinics, which I started doing when I became an independent prescriber. So that was a good addition to my role as the dermatology pharmacist, and that coincided with the biosimilar infliximab coming along. So that was how I started doing the clinics originally, by doing the biosimilar switch for that infliximab cohort of patients. And then I've continued to follow that group of patients on. It's a good place for me to sort of follow that group of patients, because I will see those patients in the clinic. I do the therapeutic drug monitoring of the infliximab drug trough and antibody levels, and I will also take part in that sort of patient journey as well, by my covering of the inpatient ward and the day case part of the ward, where we supply the infliximab for the patients where they're coming into the ward for their infusions, and then we'll supply that infliximab through pharmacy as well. So I'm involved in the whole process for the those patients.
What exactly does the monitoring of systemic therapies involve?
British Association of Dermatologists set out, monitoring that for patients' medications, what we should be doing at each visit for new patients, to set them up with the new drug, and for patients then for monitoring the existing medications, and there's guidance to follow for that. We've got our own local checklists which take on all that guidance. So we have templates that we all follow to make it easier for us to do the follow-up consultation with patients. So we've got a checklist that we can use to fill in, to ensure we've asked the patients all the questions and we've done all the monitoring, so that we're monitoring the patients' routine blood monitoring, such as full blood count, U&E, LFT, and then the additional things for methotrexate, such as the P3NP and the fibroscan if needed, and always checking for infections. Patients got infections, because that's a really important thing when patients are immune suppressed, and then ensuring that patients are still tolerating their medicines as well, and they're up to date with vaccinations, checking any interactions, what the patient's other medication is, and really, that the patients are being discussion, a two-way discussion with the patients, that they're getting the most from their medicines and any topical medications that they're on as well, because that really goes hand in hand to extra tools and toolkit really to use to tidy up, if you like, any additional symptoms on their skin that the not being catered for 100% with the medication.
Just to clarify, would this involve examining patients and taking blood, for example?
When I see patients face to face, we'll do the skin examination, yes. We don't take blood in the clinic, and patients will go off to phlebotomy to do that. But yes, certainly when I'm doing the face-to-face consultation with patients, I will do the patients. Yeah, that was an important thing to add as well. Yes, to do the patient's PASI score and the DLQI. So that's catered for in the NICE guidance as well. That we will the PASI score to do that when patients are initiating treatment, and also as a marker of how they're getting on with their treatment as well.
That's useful to know. And have you been able to continue this work during the coronavirus pandemic?
During the pandemic, a lot of the work was switched to telephone consultations, because obviously to just reduce the amount of patients obviously coming into the hospital, and following the guidance, the national guidance of patient shielding as well. So we were able to do telephone consultations, especially for follow-up patients, so follow-up monitoring. So I continued with my clinics as normal, if almost normal, but doing it on the telephone. So the only thing that I wasn't able to do, obviously, is do that skin examination for the patients. So it was very much relying on patients telling us what is going on with their skin. So knowing the patients anyway, I found that was okay, all right to do. And patients are very good at describing what's going on with their skin as well. And as I had quite a bit of experience in my role by then, so I was able to fully understand, what the patients were describing to me.
What is the scope for pharmacists to run isotretinoin clinics?
So I think this is a good role for pharmacists to do the isotretinoin monitoring for the clinics. It's really important to have the time to spend with the patients to be able to explain about the medication and the importance of taking it regularly, and the importance of doing the monitoring, and especially the pregnancy prevention programme for the ladies of childbearing age as well. So, pharmacists and the specialist nurses are in a very good position to be able to have the time to explain that advice to patients. It's a good role for pharmacists as well, because quite the frequent monitoring that's required for the patients, especially those who are enrolled in the pregnancy prevention programme, the ladies having to come back every 4 weeks to have their prescription renewed.